Hello everybody, and welcome to the Thursday edition of Video Clips. I have a couple of topics I want to cover today, and the first one is concerning the relationship between diabetes and increased cancer risk. And I guess I'll just start by saying one of the negative things that I've noticed for a long time, but maybe it's gotten my attention more lately, is that we have so many overweight and sick people in this country that being overweight and sick seems normal. And being diabetic or pre-diabetic, because there are so many affected people, is starting to kind of feel normal to people too. It's estimated right now that there are tens of millions, you heard that right, tens of millions of people in this country who will most certainly develop type 2 diabetes if they don't change their ways pretty soon and lose weight and adopt a health-promoting diet. And the problem is that we know that diabetes increases the risk of blindness, kidney failure, amputation, and coronary artery disease. Well, we can add cancer to the list. A 2012 study that included over 80,000 women who didn't have diabetes, some who did, showed that postmenopausal women with diabetes have a 12% increased risk of developing breast cancer when compared to women who don't have diabetes. It also showed that taking diabetes medication didn't reduce the risk. Now, studies have also shown in the past that diabetes increases the risk for pancreatic, liver, endometrial, bladder, and colorectal cancer. Now, all of this emphasizes several points that I really try to make in my lectures and when I'm talking to people. And the first is that illness is a sign that something is wrong. And if you're lucky, you get ill with something that is not immediately life-threatening. I've told many people I would so much rather be talking to you about diabetes than pancreatic cancer. Diabetes is a whole lot easier to fix than many forms of cancer. Second thing is drugs just cover up the symptoms. They don't get rid of the disease. They don't address the underlying cause, which means that a diabetic who's taking medications to control their diabetes is not getting better. Their biomarkers just look better while they're actually getting worse. The drugs don't make the diabetes better, and they don't prevent other diseases from developing, which is why diabetics on medication don't show a reduced risk of breast cancer in the study that I cited earlier. So if you're overweight, you've been told that you're pre-diabetic, diabetic, you've been diagnosed with any condition, don't buy the sales pitch that medications are going to help you to control your diabetes or any other condition. They simply manipulate biomarkers and give you a false sense of security. Diabetes or pre-diabetes is the beginning of a very dreadful descent into degenerative conditions, and it can all be avoided with dietary change. So the other thing I wanted to talk about, and I love this story, is concerns Japan's school lunch program. An article about this was sent to me by a Japanese American, and I just love it. And I'll just start by saying, I love America, I love living here, I don't want to live anyplace else. Visit, love that, but not relocate. I think this is a great country, best opportunities are here, but my gosh, we can learn from some things that go on in other countries where some superior programs are offered. And one example is Japan and the school lunch program. I mean, the economy's in a shambles, but there's some really wonderful things going on in schools there. Now, according to an article in the Washington Post, the food served in schools is fresh, locally grown, it's almost never frozen. There are no mysterious ingredients, and parents have even been known to call the school to ask for recipes because their kids have come home loving the lunches so much they want their parents to make these foods at home. In Japan, health is a priority, and serving nutritious, health-promoting meals in schools is a source of national pride. Now, the meals are made from scratch. They feature rice, vegetables, fish, and soup, and mealtime is a community activity. In the lower grades, the kids take turns putting on white coats and serving their classmates, and they eat in the classroom. If they don't finish their lunch, there are no vending machines or school stores from which they can purchase other things to eat. So, as you might imagine, the kids are pretty good about eating their food. The result is predictable. Japan's obesity rate for children is one of the lowest in the world. It's been declining for the last 6 years, while in the United States, of course, it's been going up. These kids are expected to live to an average age of 83. In the United States, we are expecting that many kids will not outlive their parents. This is the first generation where that may be the case. The differences in food start with very stark differences in public policy. The Japanese government, like almost every government, sets nutritional guidelines, but there's very little regulation. Individual meals are not expected to meet precise guidelines, and a school nutritionist develops the recipes and menus without government interference. Now, the government states that if it deems that the school food is not nutritious enough, it can step in at any time, but nobody can recall that this has ever happened. In addition to local control over the food, the funding is also localized. The local municipalities pay for the programs and bill the parents. It's about $3 per meal. They offer reduced cost and free lunches to kids who need them. It's about what's spent per student in the United States. Our kids are just eating a lot of fried and junk foods for that money instead of rice and vegetables. There are no desserts other than fruit, very little fried food, very little wasted food, which is a result of both serving good things and also the fact that Japanese children are taught at an early age to eat what is given to them. It's not really a bad idea when you think about it. School food is accompanied by education. The kids are often told by their teachers or food service staff why they should eat their vegetables. The meals are varied and they contain combinations of foods that make them acceptable to the kids. So seaweed is mixed in with vegetables and rice and things that the kids are inclined to like. Now, what I thought was so sad, according to the Washington Post article, is in spite of this, not anybody from the United States has contacted the Japanese government to get more information. Gosh, how could we do this here? And nobody from any other government is calling either. So we should learn from people who have positive experience, and we sometimes don't do that here. Now, our school lunch program here in the United States, it has no chance of being reformed unless it's totally dismantled. Advocacy efforts by Michelle Obama, while they are well-intentioned, are directed at calorie restriction but not wholesale changes in the menus. Large agribusinesses provide and will continue to provide much of the food, and the government dumps surpluses of awful foods like cheese into the lunch program. The feds tightly regulate school lunches, and they're responsible for the resulting mess. So fortunately, there are some good things going on. There's a growing movement toward more local control of education in general. And if that could be expanded to take care of the food in the schools, that would be great. That's one thing that might change things. And then parents just getting active at the local level and trying to do something about it, which we can help you with that, by the way. Our foundation, the Wellness Forum Foundation, offers teacher training. So if you're a teacher and you're watching this and you'd like to offer some information about plant-based nutrition to your students in the classroom, we offer a training program once a month called Introduction to Plant-Based Nutrition. And we will provide any teacher in a public or private school that completes that class with age-appropriate educational materials to use in the classroom. So the next program is February 28th at 7 p.m. Eastern, and you can contact us if you are interested in knowing more about that. Well, that's all for now. Have a great day and a great weekend, and I will be back to you again next Tuesday.